All right, so we're just going to wait a couple more minutes and then we will get started. Just going to grab my timer. Give me 1 sec. Okay. Okay, why don't we get started? It's almost 5 after. Welcome everyone, I'm Dr. Melissa Cugliari. I am the resident naturopathic doctor at the Sport Medicine Clinic at the Toronto Athletic Club. I'm so excited to be here with you today to talk about heart health, which is one of the most important topics because heart health is something many North Americans struggle with. So there's a lot we can do naturopathically, particularly in the area of nutrition. So we'll focus mainly there today. Now, I do have my PowerPoint here. This is available if you would like a copy at the end of today's presentation. I will be putting my email and contact information up. I'm also available for virtual consultation at this time. So please feel free to take down that info and send me a note if you'd like a PDF copy of this presentation so that you don't have to take notes. Okay, so let's talk first about what we'll be going through today's agenda. First, I'm going to chat very briefly about the cardiovascular system, just give you kind of a 101. We'll talk about cardiovascular dysfunction, what that looks like, and then some ways we can naturopathically support heart health, things like nutrition predominantly, and then we'll also talk briefly about lifestyle factors. And then we'll have time for some questions and answers. So you can see on your Zoom screen there is a little tab for Q&A. It's just at the bottom of my screen. There's a chat function as well. Feel free to type your questions in during the presentation. That's an easy way for us to keep track. You can either send them privately or publicly, and then at the end, I will do my best to address as many questions as possible. Okay, so first let's talk a little bit about the human cardiovascular system. I just want to double check and make sure. Looks like everyone can hear me. I don't see any issues there. Okay, so the human cardiovascular system. Move my face to the bottom there. So the human cardiovascular system is part of the circulatory system. It consists of the heart muscle, your veins, and your arteries. And essentially, it's responsible for blood flow. So all of these organs, your heart, your veins, your arteries, are responsible for getting blood to all of the tissues in the body. And why is that important? Blood flow is super important because it's blood that provides your cells with nutrients like amino acids, which are proteins, electrolytes, oxygen, carbon dioxide. Our circulatory system also circulates hormones, which are incredibly important in terms of how our systems function. Without hormones, our body wouldn't know what to do. Those are our signaling molecules. And many other things. The blood brings lots of things to the different cells of the body. And essentially, blood nourishes the cells. It helps the immune system fight disease by providing the nutrients and blood cells it needs. It helps us stabilize our temperature, our pH. So really, blood flow is all about maintaining homeostasis, which is a fancy way of saying balance. So without blood flow, it's very hard to stay balanced. In fact, your cells will die without adequate blood flow. So really, really important that we have a strong cardiovascular system so that your organs get blood. So in short, blood makes a hospitable environment for our cells, and it's essential to life. So we always want to be supporting the cardiovascular system in order to get that nice, healthy blood throughout the body. So now we'll talk a little bit about heart and cardiovascular disease. I'll refer to cardiovascular disease from here on in as CVD. Now, unfortunately, cardiovascular disease is the #1 killer in North America and in the industrialized world. It is the second cause of death in Canada, the second leading most cause of death. So it really is something we want to focus on learning about, how we can treat it and how we can prevent it. So when I'm talking about cardiovascular disease and disorder, basically I'm referring to things like high cholesterol, high blood pressure, congestive heart failure, among many other diseases. Basically, any sort of cardiovascular disease either involves the narrowing or blockage of our blood vessels. This is also known as atherosclerosis, and or a compromised heart muscle, which is what we see in heart failure. So atherosclerosis, which is what I mentioned is the narrowing of our blood vessels, is the most common form of cardiovascular disease. It's basically when we see a buildup of fatty plaques on the arteries. So what that essentially does is it narrows the arteries. Your arteries are usually a nice round tube, and then we start to see plaques forming, which then kind of occlude the blood vessel. And that basically translates to an inhibition of our blood flow. And as we said before, blood flow and blood itself is essential to life. So atherosclerosis really prevents us from living our best lives and from staying alive. Now, one thing I like to highlight is cardiovascular disease is insidious. This happens over decades, and majority of it is caused by poor nutrition and lifestyle habits. So things that are within our control, which is actually quite empowering to remember. So now I'd like to talk briefly about how we understand our risk, whether or not we're at risk or how high a risk we are at for cardiovascular disease. So the populations we want to think about, we always want to think about the age and sex of a person. So men over the age of 40 are more at risk, and women who are postmenopausal or above the age of 50 are more at risk. People who have a family history of cardiovascular disease, particularly a male first-degree relative above the age of 55 with heart disease, or a female first-degree relative above the age of 65 with heart disease, that's going to increase your risk. We also want to consider when an individual has pre-existing health concerns, particularly diabetes, hypertension, which is high blood pressure, or hypercholesterolemia, which is high cholesterol. Individuals with abdominal obesity, so that weight gain around the midsection, are more at risk for heart disease and cardiovascular disease. And men with erectile dysfunction are also more at risk. Erectile dysfunction is generally caused by a lack of blood flow to the male genitalia. So if we're seeing a lack of blood flow to that area, generally there's a lack of blood flow elsewhere, and usually that has some sort of cardiovascular disease origin. So some risk factors to consider as well that will predispose you to cardiovascular disease. So poor lifestyle choices, including inadequate sleep and lack of exercise, which we'll talk more about in a bit. Chronic stress is something that will increase your risk. Drug and in particular alcohol use. Poor nutrition, so the consumption of processed inflammatory foods over a lifetime. And smoking, these all increase your risk for cardiovascular disease. Many of these are controllable, right? Which is, I think, great. So some complications of cardiovascular disease, we can see heart failure, heart attack, stroke, aneurysm, peripheral artery disease, and sudden cardiac arrest. So essentially what this means is that increases your risk of morbidity. So things that change your quality of life for the worse, and also mortality. So we really want to make sure that we are preventing and treating cardiovascular disease appropriately. So some symptoms to pay attention to: chest pain, tightness or pressure or discomfort in the chest, shortness of breath, swelling of the limbs, the lower limbs or the arms, also known as edema, or easy fatigability. These are all signs of potential cardiovascular disease, or some of the other things, the sequelae that can come of heart disease. Now, it's important to note, although those are commonly reported symptoms, symptoms really do vary. It depends on the type of heart disease we're dealing with. It depends on the person, or there are no symptoms at all. So this is something we always want to be mindful of, because just because we don't feel anything doesn't mean things aren't going on internally. So always be mindful. I always suggest to consult with your doctor when new or worsening symptoms present. And also we want to prevent, so booking annual physicals with your physician, so your physical exams, which include blood work, taking your blood pressure, and then other age-appropriate diagnostic testing. Really, really important. So for the purposes of today's lecture, we'll be talking about the keys to supporting health and cardiovascular health in particular, which is the prevention of the disease in the first place, and then early diagnosis and treatment. So for today's purposes, we'll be focusing on how to prevent, and also some naturopathic ways we can treat and manage heart disease. So the real goal to naturopathic support is to support blood flow, right? As I mentioned before, blood is essential to life. The circulatory system, the cardiovascular system is a necessary system to get that blood where it needs to go. So we want to support that system. We want to support a strong heart muscle. We want to support clear, full arteries. And we also want to support really nutrient dense blood. So everything we talk about today are with these goals in mind. I always like to say this too, because I find this is a really empowering thing for people to remember. Your body wants to stay healthy. It has the ability to heal itself if we give it the things it needs to do so. So it's really important to remember, if we're going to be constantly introducing things into our diet, for example, that are causing stress on the system, making it harder for it to stay healthy, we're going to start to see disease creep up. So remember, when we give the body what it needs, it can stay healthy and heal itself. And when we're talking about naturopathic care, nutrition is absolutely foundational to support the natural healing potential of the body. So let's get right into it. Let's talk about the naturopathic nutrition. That's really important when we're considering heart health. I always love to come back to this quote. It's a quote by the father of modern medicine, Hippocrates. He said, "Let food be thy medicine and medicine be thy food." So always remembering that the foods we eat can have a medicinal impact on the body. It's not just about enjoying your food. It's also about considering which foods are going to provide our bodies with what they need to stay healthy. Food can be medicinal, it truly can. So before we get into it, I always like to let people know what I say here isn't meant to be something you have to abide by 100% of the time in order to prevent disease. It's important to indulge and enjoy yourself sometimes. So I like to talk about the 80-20 rule. 80% of the time, if you follow the recommendations I'm going to lay out, you're less likely to have to deal with disease that are diet and lifestyle related. So remember, you don't have to be perfect, but just doing your best to stay as healthy as possible 80% of the time so that you have a balance. So when we're talking about preventing or helping treat anything heart disease related, the Mediterranean diet is one that comes up in the research again and again. So I have a little pyramid here to illustrate what that diet looks like. In a second, I'll kind of lay it out for you on a plate so you know what your meals should look like. But with a Mediterranean diet, you see the certain lifestyle factors at the bottom that we'll talk about. And then from there on, it goes to discuss which ingredients you should be focusing on. So the base of the Mediterranean diet pyramid are your fruits and vegetables. We also have our healthy whole grains, healthy fats in there that we'll talk about. And the next tier we get into proteins. The first tier of proteins are fish and seafood. So consuming fish and seafood regularly definitely decreases risk of cardiovascular disease. And then from there on, we have smaller and smaller portions of other animal products. So things like dairy, poultry, we have our red meat at the top, and at the very top, we have our sweets. So this is very rare that these things are consumed, sugar. So you really want to focus on those base levels of the pyramid most of the time. In terms of beverages, water is absolutely essential. We'll talk about hydration. And wine on occasion, red wine, shows to have some protective benefits some of the time if consumed on an occasional basis. We'll talk about what occasional means in a bit. So what does that mean? So this is a diagram I come back to again and again with my patients and in my talks. It's kind of like a plant-based Mediterranean style plate structure. So at most of your meals, particularly lunch and dinner, you can use this as a guideline. We always want your meals to foundationally consist of vegetables. Dark leafy greens, your other pigmented vegetables, your purples, oranges, etc. We want to be aiming for about 8 servings of vegetables per day, which translates to approximately 4 cups. Okay, so 2 cups at each meal. The more variety you get, the more nutrients you're going to get. These nutrients are going to then go into the bloodstream where they can be delivered to your cells for optimal function. Really, really important. They're going to keep the heart muscle strong. Then we also have our grains in the top right corner of our plate. Grains, as you saw in the Mediterranean pyramid, are a predominant part of the diet. Now, these grains are not meant to be processed. Whole grains are what we want to look for. So things like brown and wild rices, quinoa, whole grain pastas are really, really wonderful to include. That quarter of the plate translates to about the size of a cupped palm as a serving. Then we have our protein, which is equally as important to help build a strong heart muscle. We want to pay attention to the type of protein. In the Mediterranean diet, fish and legumes are the main types of protein consumed. You can still consume poultry or red meat, just on a much rarer basis. We want to opt for a more kind of like vegan, pescatarian diet. So really the main animal products you're consuming are fish, if possible, avoiding all the other stuff. So dairy, as you can see, we want to avoid that most of the time. And then our healthy fats are really important. You saw that in the pyramid as well. We'll talk about what that means, what some of our healthy fats are momentarily. So another thing to consider that's really, really important in the Mediterranean diet is our fiber. Fiber content is so, so important. When we eat enough fiber, that fiber is going to help promote digestion and really healthy detoxification through bowel movements. And what that means is that when we have a bowel movement, we want to get out the things that the system doesn't need. In particular, when we're talking about heart health, we want to be eliminating excess cholesterol. Cholesterol is one of those measures that's shown to increase risk of cardiovascular disease. So we want to keep our cholesterol levels in normal range, and eating fiber in the diet is one of the things we can do to help that. So what does that mean? Fiber, of course, our fruits and vegetables are full of fiber. So having 2 to 4 servings of fruits daily. Your berries are a really important one for cardiovascular health because they're so high in antioxidants. And then our vegetables, 8 servings a day, like I said earlier, 4 cups a day of veggies. And then unprocessed grains, 2 to 4 servings daily. We talked about what that looks like. I have organic sourdough on this list as well. That's a really great one. And then flaxseed. This is a really easy way to get a lot of fiber in a small serving. So I like to have flaxseed in my diet daily, for example. 2 tablespoons of ground flaxseed and a little bit of applesauce. It's a great way to ensure that you're getting enough fiber. So excellent. Now I'll talk a little bit about 5 other foods I suggest including daily for cardiovascular health. These are shown in the research to promote a healthy heart and circulatory system. So the first one, which is huge in the Mediterranean diet, it's our extra virgin olive oil. We want you to be getting 2 tablespoons of that daily. Some of my patients literally take it in a spoon, or you can use it in cooking over salads, etc. Then we have our celery. Celery is so important to maintain good blood pressure levels. It's really high in minerals. So I would say 2 stalks of organic celery is all you need. That's what the research shows to help manage blood pressure. Then we have our raw nuts and seeds, particularly in the research, we see almonds and walnuts for cardiovascular health and cholesterol levels. So about 1/8 of a cup or 2 tablespoons of these nuts daily. Really important. You can alternate, have a bit of both every day. Great snack with a bit of fruit, like we mentioned before, which is high in fiber. And our last 2 foods for heart health are fish. We talked about the importance of fish. Organic, wild caught is great. And fish oil is a great thing to include if you find you're not able to get fish on a regular basis, or if you're someone that doesn't like eating fish. Fish oil has to be very high quality. There are a couple of brands out there I like. I'm not affiliated, but the quality control is excellent. NutriC is one of them. Nordic Naturals is another. So having that on a daily basis can be helpful if you're not able to eat fish regularly. And then the last one, which is kind of a fun one I like to include, is organic dark chocolate. So this is really, really high in minerals and antioxidants. So having 2 squares, the higher the percentage, the healthier it is. So I like to say like 80+% of organic dark chocolate daily is really great for heart health. It's a fun one. So I don't know if you remember, but at the base of our Mediterranean diet pyramid, there were some lifestyle factors. And one of those is how you eat your meals. In other words, meal hygiene. So I always suggest, and the Mediterranean diet is consistent with this, eating in a calm, relaxed environment. Ideally, at least 1 meal a day, perhaps dinner, is in the company of loved ones or your support system, or now since many of us are at home, perhaps you have a loved one on Zoom or FaceTime and you share a meal together. This sharing in the meal and eating in a calm or relaxed environment where you feel safe and comfortable helps decrease stress levels in the body and actually improves our ability to absorb the nutrients we are eating. So really important to consider. So we talked a lot about what we can do, and I do want to touch briefly on what we should be avoiding, because as I said at the very beginning, one of the things that causes heart disease is the consumption of poor quality foods throughout the lifetime, over decades. So what kind of foods do we want to be avoiding? I always come back to this quote in all of my talks. It was said by a functional medicine doctor, Dr. Mark Hyman. He said, there's no such thing as junk food. There's just junk and food. So if you're questioning it, if you're not sure, generally stay away. That may fall into the junk category. We want to stick to foods that are whole, fresh foods with an expiry date, usually found in the perimeter of your grocery store. Really, really important. So here you see your fruits and vegetables, so key. So not only do we want to eat whole foods, we want to avoid inflammatory foods. These are the foods that fit into that junk category. So these are our processed foods. Foods that have long ingredient lists, sometimes things that we don't even recognize. We want to stick with foods that don't even need an ingredient list. These are our fresh foods. These are our foods that are going to promote health, whereas our processed foods with lots of ingredients usually are detrimental to health. Now, this also includes processed grains. So I talked about grains being an important part of the Mediterranean diet. We want to stick to their whole grains that are close to what they look like in nature. So like your wild rice is a great example of that, versus your processed grains, which are like our pastries, our breads, things that are processed and don't look like their natural form. We want to avoid those for sure. Sugar is also incredibly inflammatory. And inflammatory foods, what they do is they inflame the arteries. They cause those plaques to build up. They increase your risk of heart disease. And sugar is huge. Sugar also depletes the immune system. It just wreaks havoc on the body. So we want to avoid sugar, not just sugar in our coffee, but also sugar in foods. So looking for ingredients on our food list like evaporated cane sugar, any sort of syrups, brown rice syrup, whatever it may be. Always look at the foods, even the ones you find in the health aisle or the organic aisle. Many of these foods have sneaky ingredients, some of which are a form of sugar. So avoiding that 80% of the time is really, really helpful for heart health. We also want to avoid poor quality fats because these are incredibly inflammatory and they are what cause those plaques to build up in the arteries. So detrimental to your heart health and circulation. So what does that mean exactly? We want to avoid our poor quality fats like saturated fats found in red meat and dairy in particular. So we want to eat those foods more rarely. And also poor quality oils, which are just rampant in so many of these processed foods with long ingredient lists. So things like canola oil, grapeseed oil, corn oil, all other vegetable oils essentially you want to avoid. So exercise particular caution when you're eating fried foods, foods with sauces, pre-made dressings. These tend to have these cheaper, more poor quality oils in them. Also a hidden source for lots of sugar. So be mindful of these things. Generally when we're eating out, it's important to try to do your best to order sauces on the side. Instead have some olive oil and lemon. Other safe fats that are not just safe, but they're encouraged for you to eat are things like coconut, extra virgin olive oil, flax oil, hemp oil. These are really, really great. Cooking is great for cooking and olive oil. Those are safe to cook with. Flax and hemp you want to eat raw, so over salads. Avocado is a great source of healthy fat. Avocado oil is really great too. And then our raw nuts and seeds. So we talked about the importance of almonds and walnuts. Any sort of raw nuts and seeds are safer fats to consume. So another dietary consideration, this is more related to blood pressure, is to restrict your sodium intake. Now, sodium is actually healthy. It's a form of mineral that our body does need. We don't want to eliminate it entirely. So the way I like to suggest in taking your salt is by cooking at home and adding your own high quality salt. When you eat foods that are processed or purchased out, they tend to be higher in sodium, unnecessarily high. So if you're eating those on a regular basis, you're going to be boosting your internal sodium levels, which causes a whole slew of imbalances, including high blood pressure, which predisposes you to cardiovascular events. And then, consider seasoning with herbs and spices as well to add flavor. We don't always just need salt. And when you cook at home, which many of us are right now, you're able to add other things to flavor your food as well as a high quality salt. And generally when we add our own salt, we're adding a lot less than what you find in commercial foods. So it's a lot of dietary stuff to remember, but always think back to this 80-20 rule, right? I find a lot of people, they'll jump on the wagon for a couple weeks or a month and feel really good. And then they'll have that one cheat meal, a processed meal, and then they're just off the wagon. They said, well, I had one, I may as well continue. It's okay to have a cheat meal or a meal that contains processed foods on occasion. Again, occasionally is the key here. So 80% of the time, following the diet that I just laid out will pave the way for health in most cases. Okay, so just a quick note on some nutritional supplements. Now, this is not by any means an exhaustive list. These are just general, very basic suggestions to help promote cardiovascular health long-term. When I'm treating a patient individually, we often layer a lot more, maybe more herbs or other supplements with greater specificity for their exact presentation. So always remember that. Individual care is absolutely imperative because we're all different. We all have different genetic makeup. We all have different lifestyles, different tastes. So it's important to meet the patient where they're at and for you to remember that getting the care that fits your picture will be best for long-term health, especially cardiovascular health. So the first one is coenzyme Q10, also known as CoQ10. This is a wonderful antioxidant. It's excellent for the heart muscle. This is also an important nutrient to remember if you are taking a statin medication. And a statin medication is something like a Crestor or a Lipitor. These are our cholesterol-lowering medications. They deplete this wonderful antioxidant, and that's why a lot of individuals get the muscle pain associated with this medication. So it's important to take this in conjunction with those medications, or if you're looking to support heart health, it's a great nutrient to take. The form you want to take is called ubiquinol. That's the active form of CoQ10. It's a little bit more expensive, but it's going to be worth it because you're actually going to absorb and utilize it in your cells, and that's the dose there on the bottom. Magnesium, this is a really popular mineral and excellent for a stable cardiovascular system. Magnesium is actually found in many of our fruits and vegetables, particularly our leafy greens. And it comes from the soils where our plants are grown from. Unfortunately, the soil quality nowadays isn't necessarily what it used to be. So our fruits and vegetables, particularly those leafy greens, aren't as high in magnesium as they once were. Or some people just don't eat their leafy greens, or they don't eat enough of them. So sometimes supplementation can be very helpful. There are many forms of magnesium. My suggestion is always the glycinate form. When we're talking about cardiovascular health, it's also great for muscle relaxation. And the dose is just on the bottom there. Fairly safe. And vitamin D, this is a really, really popular one now for most individuals living in Canada because unfortunately most of the year we don't get adequate sun exposure, which is what allows our skin to synthesize its own vitamin D. It's a nutrient that's required for the immune system, and the immune system is closely linked with all of our systems. So it helps keep the cardiovascular system healthy as well. So we want to be making sure we're getting adequate vitamin D, and one way to do that is to have your blood levels checked either during your annual physical or perhaps around the mid-September time. I can run this test as well. My practice is just an out-of-pocket test. It's about $30. Generally, you'll have to pay out of pocket with your physician as well. I say mid-September because this is generally when vitamin D levels start to decline for Canadians. And when we test your blood levels, we can kind of gauge where you're at and then supplement accordingly. This is a way better way to do it than to just supplement and doing it kind of with guesswork. Because then we can make sure we bring your blood levels up to healthy levels, which is what we need for a healthy body and cardiovascular system. Okay, so now we'll talk about some additional naturopathic support tools for cardiovascular health, because diet is absolutely foundational, but then we have other tiers of important lifestyle factors to consider with cardiovascular health. So exercise is key. As I mentioned before, one of the risk factors for cardiovascular disease is not enough exercise. And when we think about exercise, right, we're talking about the circulatory system. The blood is circulating. What helps our blood circulate? Movement, right? Physical movement. So the research suggests 20 minutes of brisk walking daily at minimum. The more you do, the more benefit you're going to get. But this is the absolute minimum. And when I say brisk, it's brisk enough that it's a bit challenging to have a conversation. Okay, this can be done on a treadmill. This can be done outdoors to get fresh air. In a green space would be even better. But honestly, just do what you can. Get out for a walk in whatever way works for you. Because as I said, movement is circulation support. When we exercise vigorously, we see the cheeks getting red, right? And that's signifying that the blood is flowing. Now, your cheeks don't necessarily need to get red for us to know that, but as you're exercising, we're going to have an increase in blood flow. It also helps with weight management. As I said before, another risk factor is obesity, particularly abdominal obesity, but any weight that's out of normal range can lead to an increased risk of cardiovascular disease. So we always want to be making sure that we're exercising and eating a healthy, predominantly plant-based diet to support healthy weight. When you're at a healthy weight, you're way less likely to get cardiovascular disease. or die from a cardiovascular event. Hydration. Hydration is a really important piece. I spoke about that for a second earlier. Fluids are so important because we want to support smooth, easy flowing blood, right? When you think about hydrated blood, it would be more watery versus that viscousness of like a syrup that's less hydrated, right? So we always want to be making sure you're getting adequate fluids. Depending on your height and weight, the range is between 2 and 3 liters of filtered water per day. So important to do on a regular basis. This helps to improve blood pressure, cellular hydration, all that good stuff. We also want to consider avoiding caffeine, especially if you suffer from high blood pressure, because that naturally constricts the blood vessels, right? So then the heart rate goes up, blood pressure goes up, etc. So we want to be supporting smooth flow of blood, or really movable blood vessels. So substituting coffee maybe for an organic green tea is a better option. Organic green tea does have some caffeine, but it also has some really helpful antioxidants for health and some calming benefit as well. And just to note, when we're talking about cholesterol, there's actually some evidence to support that filtered coffee is preferable over espresso-based beverages. So keep that in mind if you're someone who suffers from high cholesterol, or you have some family history of that and you are a coffee drinker, opt for filtered coffee over espresso-based beverages. So stress management, this is such an important lifestyle factor when it comes to cardiovascular health. Something to consider is balancing our stress levels and busyness with rest. We don't tend to have a very good balance in North America. It's lots of busyness, lots of stress, not lots of rest. So we want to focus on bringing that scale back into balance, and we do that just by slowing down. Slow down, don't take as much on, and really pay attention before you say yes to another, whether it's a task at work, another social event, not that that's really happening right now, but anything that fills your plate. Slow down. Is this something that you actually need to do? Is it going to cause you more stress? Do you maybe need a bit of rest or a slower day? Pay attention to what your body's telling you. Sleep is another important thing. As I said before, inadequate sleep is a risk factor for heart disease. Sleeping 8 hours plus per night, the kind of ideal sleep window is between 7 and 9 hours per night. Really important. I do suggest getting more hours before midnight. So going to bed by 10, 11 if really you need to, but by 10 p.m. is a really excellent way to support proper stress hormone levels in the body so that you're not getting too much or too little. And just making sure you're taking time away from your screens, your work, especially if you have trouble falling asleep. That's a whole other talk I do. Sleep is a huge thing, but really paying attention to trying to get enough hours, but also quality hours. And then another thing when we talk about stress management is feeling joy daily. Laugh, talk to someone who brings you an elevated mood when you leave the conversation, right? Make time for these things daily. It is so important for heart health. In Chinese medicine, the heart is associated with joy, with the emotion of joy. So we want to be making sure that we're having some joy every day. And one of the last things we'll talk about is smoking cessation. Again, another risk factor for cardiovascular disease or damage to the heart muscle is smoking. So we want to focus on stopping smoking if you are a smoker. So it's just a little cartoon to illustrate my point here. The fortune teller said to her client, "I give smokers a discount because there's not as much to tell." So kind of some dark humor there, but smoking really does cause a variety of diseases, including cardiovascular disease, and it really does shorten the lifespan. So something you really want to focus on stopping and getting the proper help to do so. I know personally, I do help patients stop smoking through modalities like acupuncture, and certain herbal treatments are really helpful. So doing what works best for you, but really trying your best to kick that habit. And the last thing I'll mention is getting out in nature. So there's actually a lot of evidence emerging that forest bathing or spending time in green spaces out in nature will decrease your risk for disease. It can decrease your blood pressure, and the effects, it's really interesting. I actually just heard a piece of information the other day that suggests that one forest bathing session, the positive effects on your health from that one session will last up to 1 month. So this isn't something, and ideally we're getting out in nature daily. Maybe it's to take your dog for a walk or what have you. But even if you're doing that once every other week, once a week, once a month if things are really dire, but as long as you're getting out of nature, you're going to see benefits to your health and specifically to the cardiovascular system with the fresh air and also the stress reduction that you will get from being out in nature. So to conclude, there are a few key takeaways, but heart health really is fundamental for overall health. And we want to support heart health through a strong heart muscle, clean arteries, and healthy blood, which we can do with some of those dietary recommendations and others. So excellent nutrition long-term, remembering that 80-20 rule, and long-term is key, right? Eating one healthy meal does not make you a healthy person. Eating one junk food meal does not make you an unhealthy person. So just really focusing on a balance, right? Eating healthy more often and eating processed foods way less often. Making sure you maintain a healthy weight, exercising properly and eating plant-based will help you do that. And then also thinking about a naturopathic lifestyle, taking things slow when you can, getting out in nature, being around loved ones, feeling joy daily, really, really important for heart health. So key takeaways, thinking about prevention, and then also that early detection with the proper physical exams and treatments through pharmaceuticals and some of these naturopathic remedies, really, really important for heart health. As I said before, individualized care is so important. So make sure you are speaking to a professional about what works best for you. So either your physician or a licensed naturopathic doctor to help guide you on your way. So now we'll have a few minutes for questions. I am going to give you my contact information. I can leave that up for a second. Let me just grab a sip of water. So my email's there. It's Dr. Cugliari at sportmedicineclinic.com. You can email me anytime for a copy of today's presentation. Alternatively, I am available for virtual consultation right now. Come September, I will be back. We are practicing, I believe, out of the Adelaide Club right now, which is one of our partner clubs. I will be back in person for things like acupuncture, but in the meantime, virtual consultations are the way to go. And you can either contact the clinic directly, there's the phone number, or send me an email if you're interested in booking in for more individualized care. Otherwise, let's see what kind of questions we have. So I'm just going to unshare. I'm screen sharing, stop share. Okay. All right, so let's see. We only have one question. Oh, no questions. Oh, no, thank you for attending, Jean. Okay, great. So thank you guys for coming today. If questions do come up, if there's something you forgot to ask, please send me an email. Again, it's Dr. Cugliari at sportmedicineclinic.com. So that's Dr. DrCugliari at sportmedicineclinic.com. And I'm happy to assist or provide you with a copy of today's presentation. So I hope you enjoyed and be well, and I hope you have a wonderful afternoon.